Okay, ma'am.
Okay, have you understood now?
Yes, ma'am. Thank you.
Okay, okay. So now conducting a health assessment. So for conduction of health assessment, we have to see reviewing general information. Then reviewing general information means we have to collect all the information from the client. I have already explained in health history that we have to collect the name, we have to collect the chief complaints, history of present illness, past illness. So all this information we have to collect. So for conducting of health assessment, we have to reviewing the general information. We have to collect all the information from primary or from secondary sources. Primary means the client only, and secondary means other healthcare person maybe, or maybe the family members, or maybe his previous prescription of treatment plan. And then consideration of the culture. So we have to consider about the culture also. We have to respect the culture, and by following the culture, by following that only, we have to go for health assessment. So cultural sensitivity is very important, so we have to follow that also. So preparation of the client. So for health assessment, the important point is preparation of the client. We have to prepare the client very properly. We have to assess the physiological and psychological needs before collecting the all the information. We have to see the psychological condition of the patient. We have to see the patient is in which mood, if he can talk or not, if he is in the mood of talking or not. We have to assess everything. And how we are going to assess the client, we have to explain what's the purpose of health assessment. We have to explain to the client thoroughly. We have to make understand them. Then preparation of the environment. So it is also a important point. So you have to prepare the environment. So it's important for both nurse and the client. So a very welcoming environment should be there. The client should everyone is coming now also. It's already 10:20. The client should open up. The client should talk. So the nurse should convince them to talk. Then organizing and documenting. So after collecting all the information, we have to document. We have to organize properly. We have to document all the information we have collected. Then introduction to the client. So the nurse or whoever is taking the health assessment, so the nurse should introduce to the client. They should introduce to herself or himself about them. Then health history. So in health history to everything will come. In health history, his complaints, his abilities, disabilities, everything will come. So we have to ask health history. So for health assessment, we have to go for reviewing general information, consideration of the culture, preparation of the client, preparation of the environment, organizing and documenting, introduction to the client, health history.
Mm. Ma'am, excuse me, ma'am.
Yes,
Preparation of the environment, ma'am.
yes.
In
A preparation of the environment.
yes.
See, in proper environment only we can assess a client. So the environment should be comfortable for both nurse and for both the client, because privacy should be maintained. A patient will not open up in front of everyone. Okay, so we should maintain the privacy. We should give him the privacy. We should maintain the environment properly. So a warm, a quiet, and then a welcoming environment should be there for the patient. Then only the patient will open up. So that one is preparation of the environment. Okay.
Okay, ma'am.
Okay. Then have I explained you the purpose? Yes. Okay. Now the process of health assessment. So process of health assessment. So in process of health assessment, there will be inspection. So in inspection, it is the systematic visual examination of the client, or it is the process of performing deliberate purposeful observations in a systematic manner. So in inspection, we'll just observe a client. We will not do anything. We'll just observe a patient. We'll visualize the patient, and like that we'll inspect, we'll assess a patient. It involves observations of the color, shape, size, symmetry, position, and movements. So observations of the color means we have to observe the skin color, like if he is having jaundice, or any any cyanosis or not. We have to see the skin color. We have to assess. Then shape. We have to see the shape of nose, shape of ear, if it's symmetrical or not, if it's in proper position, the movements of joints, the joints are moving or not, that they can move their joints, they can move properly or not. We have to observe all this in inspection. It also use the sense of smell to detect odor and sense of hearing to detect sounds. So so they can properly hear or not, so they can properly smell or not, everything we have to ask, everything we have to inspect in inspection. So here nothing we have to do, we have to just ask them, we have to observe them, and we have to write it down. Then general inspection of a client focuses on the following areas: overall appearance of health or illness. Overall appearance means will visualize in inspection. So we have to see overall appearance, if he is in normal state or not, if he is well groomed or not, if he can talk properly or not, if he look healthy or not. We have to see in inspection overall appearance of health or illness, because here we'll only visualize. That's why we have to just see here in inspection. We have to just observe. Then signs of distress. If he is any is if he is having any deviation from the normal, then the signs and symptoms will be there. So we have to observe the signs. Facial expression and mood,
Ma'am,
we have to
ma'am,
observe. Yes.
it is not need to note it down. Just we visualize and just we observe passion, ma'am. Just we observe.
Yeah, just
And
to observe, nothing we have to do, we have to just observe the patient, and we have to see whether the patient is in normal state or not. We have to see the skin color, we have to see the size, shape, symmetry. Then
ma'am, this all things, shapes, colors, joints, sound. If any abnormalities occurs, then we need to note it down.
yes, yes,
Or
yes,
ma'am, just
yes, if any abnormalities are there, you have to note it down. You have to collect all the information. If something is normal also, then you have to also write it down. If something is abnormal, then you have to write it down. Okay.
okay, ma'am.
Okay. Then facial expression and mood. So by looking at face only, we also can tell that if he is in good mood or if he is in bad mood. So by looking at their face only, we can tell their moods. So we have to observe their facial expression also to tell their moods. Then body size, if he is overweight or underweight. Then grooming and personal hygiene, if he is or she is well groomed, or if he or she is maintaining personal hygiene, we have to note it down. Till now, have you understood?
Yes, ma'am.
Okay. Then palpation. Palpation is, it is the use of hands and fingers to gather information through touch. In palpation, we'll use our hands and fingers, means we'll touch the organs, we'll touch the patient to gather the information. Here we'll use the hands and fingers